If we look at her now, having restored the mid-face volume, we can clearly see that we have already improved the appearance of the tear trough on the treated side indirectly by creating support in that area, and that recruits skin from the lower eyelid, as well as it shortens the expansion of the tear trough to the cheek. By recruiting the skin from the lower eyelid, it has also improved the dark aspect of these dark circles under the eye. If you look in more detail, you can still see that she would require a little bit more volume in the tear trough directly in order to make this a perfect transition from the cheek into the lower eye area. In the tear trough area, I mentioned that before, Juvederm Volbella is the perfect product from the Juvederm VYCROSS collection to be used, because it does give a good support without overcorrecting, and due to its lower hyaluronic acid content, it does not have the tendency to bind that much additional water, and by that we can avoid additional swelling, which is a side effect that we don't want to see appearing, especially in the lower eye area. It is very important to keep in mind that one should clearly undercorrect in the tear trough area, especially in the first injection session. So I would recommend not to inject more than 0.1 cc of Juvederm Volbella per injection point in the tear trough directly. You can either ask the patient to close the eye. If she is a brave one like she is, I prefer to let her keep the eyes open, because it gives you a better impression of the actual appearance of the tear trough, because by closing the eye you relax the muscle, and that changes the anatomy of the area. So if you don't mind, you just look ahead. I stretch out again. I go directly to the periosteum. It is important not to stay superficial in that area. I aspirate. I stay on the bone. Do you feel anything?
Yeah, just a little. Doesn't hurt.
Irritating, huh?
Just bone, touching bone, that's all.
It was just this one little pillar that I created that shortened again the expansion, which makes it a very small indentation in the medial eye area. Now that's it. So the next point I place medially of that. Again, stretching the area with my 2 fingers, going perpendicularly. Aspirating. Injecting, very small amount of volume, deep, supraperiosteally, clearly under the orbicularis oculi muscle. 2 injection points, you see already a significant difference between this side and the other, and after these 2 injection points I realized that she doesn't require a more medial injection point in that area for now.